Here now with more Republican Representative Tom Price, incoming chairman of the Republican Policy Committee, who's also a doctor, and Democrat Debbie Wasserman Schultz, member of the Appropriations Committee. Good morning to you both.
Good morning.
Good morning.
Congresswoman, let me just start and let Congressman Dr. Price make a case for doing this. What's the point? That's what we keep asking, Doctor, since it's probably not going anywhere, at least not for a couple of years.
I know this will come as a grand surprise to some folks, but we're going to do what we said we were going to do in our pledge, and that is to repeal Obamacare. We're going to fight as hard as we can to make certain that we end the job-killing policies that were put in place over the past 2 to 4 years, and one of those was Obamacare. And in our pledge to America, we said that if we were given the privilege of leading once again, we would vote to repeal Obamacare. We would work as hard as we could to make certain that the job-killing provisions in that bill never came to pass, like the 1099 provision that punishes small businesses. And then we would work as hard as we can to replace it with positive patient-centered reforms in health care. So this is just the fulfillment of a promise that we made to the American people.
Representative Wasserman Schultz, you might as well start.
Sure. What basically Tom has just said is that their obsession with repealing health care reform and their obsession with going after President Obama means that they're going to take up hours and hours and hours of time on repealing health care reform fruitlessly, which isn't going to happen, and which is going to add to the deficit. Remember, health care reform saves $143 billion, cuts the deficit by $143 billion over 10 years, $1 trillion over the second 10. And the job-killing rhetoric is such garbage. In fact, in the last month, the jobs report showed that the biggest increase in any sector in job creation in the private sector was in health care reform, a 13% increase. So every minute that the Republicans spend fruitlessly trying to repeal health care reform is one less minute they're spending on job creation and turning this economy around. And on top of that, they spent a lot of time during the campaign talking about cutting the deficit. The first vote out of the gate is going to be to add about $1 trillion to the deficit. Well, it's total hypocrisy.
You talk about being out of touch with the American people. Debbie acts as if November never even occurred. If you remove the gimmicks that were in this bill to get to the $143 billion of, quote, deficit reduction, in fact, what you have is an additional $700 billion of deficit in this bill itself. And the American people are sick and tired of Washington spending money that we don't have. As a physician, I can tell you that the patients and the physicians that I know across this great country are saying, look, this bill is destructive to the quality of health care. It destroys accessibility, especially for seniors right now, as we're seeing many Medicare Advantage seniors not being able to have the insurance that they desired. It's destructive to the affordability. You're seeing costs rise for not just employers, but employees as well. And it's destructive for quality. In fact, on January 1 of this year, the denying board, the rationing board that Dr. Berwick so desires, the Independent Payment Advisory Board, that can deny care after it was provided by the physician, has gone into place. So those are the kinds of things that the American people objected strenuously to, and they spoke out on November 2nd, and we look forward to fulfilling the promise that we made.
Let's talk about January 1st. On January 1st, just a few days ago, with repeal of health care reform, the Republicans will take away a 50% cut in brand name drugs that seniors got. Well, let's put a human face on what repealing health care reform will mean. It will mean that children, once again, and in a few years, everyone will be able to be dropped or denied coverage for the pre-existing condition that they might have. It'll mean right now that young adults will no longer be able to stay on their parents' insurance until they're 26 years old. So the woman who came to me a few weeks ago and said that she saved $3,000 last year being able to add her 2 adult daughters onto her insurance policy, that savings will be gone. For women, it will mean that domestic violence and pregnancy and simply having ovaries is going to be considered a pre-existing condition again. And what we're going to do is put insurance companies and profit-driven decision-making back in the driver's seat instead of decision-making between doctors and their patients. That's what the Republicans are all about.
That's the kind of policy that was rejected on November 2nd. But the fact
really?
of the matter,
you think that people want insurance companies? Tom, you think that Americans want insurance companies to make decisions about whether or not they get coverage for a pre-existing condition? That is absolutely not what November 2nd was about.
The fact of the matter is there are patient-centered reforms that we offered at the time.
That you never implemented before.
and that we offered at the time, and believe that that's the way to go. The status quo is not acceptable. In fact, what the bill did, what the law has done, is to put the federal government essentially in charge of health care in this country. That's
that
wrong.
Is utter
that's
garbage.
not what the American people desire. And I know that Debbie doesn't want to hear that, but that's exactly what it did. And so what we look forward to doing is putting in place patient-centered reforms that will be positive for patients and for physicians.
We passed private sector health care reform, and that's what we're going to implement.
Congresspeople,
we're
going to come together on. You both look like Chili Pepper fans to me.
Absolutely.
No, really, Debbie.
Bob Seger here.
Bob Seger and Silver Bullet and Congressman. Seriously, Chili Peppers, or you love that front man? What's his name? Anthony Kiedis or whatever?
Oh, it's not about the front man. It's all about the music.
All right, great. Thanks for playing along. It's a good way to. You guys should do that in Congress. After like a caucus or like yelling and stuff.
How about a little
come together with a little music.
All right. See you later. Thank you.